The planet's fast-growing population has passed the urban tipping point. In 2005, for the first time, the world's urban population exceeded the number of people living in rural areas. And this trend is rapidly accelerating in developing nations. By 2030, more than 2 billion people will be added to cities in Africa, Asia, and Latin America. Many will live in megacities containing more than 5 million people. Today, there are 21 megacities. By 2025, that number will more than triple. What many don't realize is that most of this increase in population will come from reproduction, not migration. In fact, reproductive increase in population will account for as much as 75% of urban growth in Africa alone. Urban living has many advantages, but the poor often do not benefit from them. Today, more than a fourth of urban populations live in slums without easy access to basic health services, resulting in higher infant mortality rates, higher crime rates, and a greater strain on public infrastructure. It's often assumed that people in urban centers are better off than their rural counterparts. In fact, the urban poor face challenges that are just as severe as those in rural settings. Poor urban women are more likely to give birth outside of health facilities, and their children face a greater risk of disease. Plus, because of limited access to reproductive health care and family planning, they have much higher rates of unintended pregnancies. And that's why providing the urban poor with access to voluntary family planning, including information and contraceptive choices, makes a significant impact when it comes to helping reduce the number of unintended births. It's one of the most low-cost, high-return investments that can be made because it reduces future expenditures on public services such as healthcare and education. Family planning also allows couples to have only the number of children they want, which helps enable healthier families and a better standard of living. The key to cost-effectively improving reproductive health for the urban poor is a coordinated effort and funding from governing bodies, policymakers, communities, and private organizations alike. National governments are working in coordination with international donors to integrate family planning, education, and service provisions into several urban health, nutrition, water, and environment projects being implemented by local partners in different countries. The success of programs like these demonstrates that we can work together to make a big difference for the urban poor, and it all starts by ensuring access to quality reproductive health care that empowers a better quality of life, so everyone can have a better tomorrow. This educational message was brought to you by the Futures Institute. Find out more about how you can take action to help improve reproductive health for the urban poor around the globe by visiting us online. Thank you.